Hi, Elisha.
Very good afternoon.
Good
How are you,
afternoon.
Deepak sir?
Wonderful. We'll start in a minute or so.
Yeah, sure.
So, hello, namaste, namaskar, good afternoon, good morning, or maybe even good evening, in whichever part of the world you are joining us from. Another Sunday, another episode of the Sunday Bloom Talk Show. 269. Yes, 269 weeks non-stop. Come rain or shine, online or offline, every Sunday afternoon India time. It's time to be on the Sunday Bloom Talk Show. We speak with people, change makers, speakers, athletes, trainers, coaches, doctors, lawyers, name it, and everyone has come and shared their experience, their knowledge on the Sunday Bloom Talk Show. Everyone in their own little bit on that small thing where they are wanting to change the world, make the world a better place to live in. My name is Deepak R. Khemani, and I am one of the co founders of Bloom, along with Abhijit, my other co-founder, and Payal, who is currently traveling. It gives me great pleasure to welcome you all to our 269th episode. We have a very special guest who is joining us today. I will give you a brief introduction of her, and then I will ask Abhijit to take over from there. Joining us today is Elisha Virani. She is known as the reclaimer psychologist. So, this is something which I am hearing for the first time. We will understand more from her. What does that mean? She is a psychologist, a therapist, a speaker, content creator who is helping young professionals, working professionals, young adults overcome emotional overwhelm, and reclaim their self worth through her signature reclaim method. As I said, this is something we will learn from her today. She has experience in trauma, anxiety burnout, and self growth. She blends psychology and relatable storytelling to make mental health accessible and actionable through therapy, workshops, podcasts, digital tools. Elisha empowers individuals to navigate challenges like imposter syndrome, boundaries, silent trauma, and guiding them towards lasting transformation. Her mission is to guide you towards clarity, calmness, and lasting change so that you can live with greater self worth, emotional strength, and authentic connection. Welcome to the show, Elisha.
Thank you. Thank you so much, Deepak sir, for inviting me. And
Let me
we are
ask,
here
yeah,
today.
Abhijit. Abhijit, please join in.
There's
Okay.
some concern with the internet.
Yeah, that's okay. Yeah, Abhijit is in.
Yeah,
Abhijit, would you like to take over?
sure, sure. So there were three things which Deepak said, which also were something I'm hearing it for the first time. First is the second is emotional overwhelm, and the third is your reclaim framework. So could you take that in order exactly what these are?
Yeah, can I just take a moment? There is some internet connection issue,
Sure,
and
sure.
I'm
Yeah.
even unable to hear you properly. So just give me a
Please,
minute.
please go ahead. Please go ahead.
Is it better now?
Yeah. Yes.
Lovely. Thank you. Thank you for your patience. Could you repeat, Abhijit sir, what you
So,
were
so
talking about?
one is there are four things. Now I'll add one more. So one is from a burnout to a breakthrough. So technically, how can one achieve a burnout? First is how does one burn out in the first place? Why does he do so? And from that, how can he achieve a breakthrough? The second is, and that would be that there would be an emotional overwhelm by which he would have burnt out. So what's that? And maybe those two questions are can be combined. And the third is you achieve that breakthrough, I believe, by your signature reclaim framework. So what exactly is that signature reclaim framework?
Sure. So thank you. Thank you for the question, firstly. And so in terms of burnout, so there is a lot of many, like there are many things which one gets through in everyday life situations. And for example, you're working, you might not feel like taking up a call of a person, or you might start ignoring a person altogether. There's so much of exhaustion, and you're feeling emotionally overwhelmed with not understanding what exactly you're feeling through the body. So, in that process, what is happening is that I am just not feeling connected to people. I'm not feeling even connected to the part of myself, as well as not being connected to probably the work which I used to feel passionate about. For example, I can give you my example, which I felt it in 2023 year, where I'm so passionate about mental health. But in that space, I was not in a good mental health framework. And I just felt like this is too much for me to handle. And I was giving in a lot of myself to people, to my clients, to my work. I have to be available to them because I'm in a helping profession. And that kind of somewhere made me realize that I really genuinely need a rest. And rest is in so many different layers that one can feel rest. Okay. There is one which is called as emotional rest. There is one which is physical rest. There is one spiritual rest. There are so many rests that one requires around that time. And you may or may not understand what type of rest do you really need. And also question yourself as to how much am I supposed to rest? And that is something that I remember very vividly, that I used to ask myself that isn't 2 days of rest enough? Isn't 3 days of rest enough? And that used to be there for a longer period of time. And I remember in my healing journey that I felt around that time that it is important and not to ask that question to yourself, because body has its own time, place to heal you. And it is where you're not working against your body, but you are being in sync with it as to what is it really. So that really helps further. Does this help in understanding the burnout part? And you can ask me the second question. I think I lost the track for the second question.
Yes, Abhijit.
Do that with maybe your signature reclaim
Reclaim method.
framework. Yeah.
Yes,
What?
yes. So once we understand, reclaim is an acronym for R stands for recognizing what is the root cause of it. A lot of times, we may add a lot of things to our daily life to understand. Probably we need a routine. Probably we need some productivity hack. Probably we need something to add to understand that, okay, you know what, I'm feeling this, so let's do this. It's actually going opposite to our body, where we are thinking to do something more, whereas we need to subtract something from our life because we are feeling burned. And I love this to understand how it is like, where you're burning something. So basically, you have a lot of fire, but that fire is being scattered throughout different areas of your life. So that's why you are burning yourself through different areas. And understanding the root cause of it is one of the most important. So that is R. He is embracing your emotions rather than escaping from. A lot of times what we do is we are pushing away those feelings. We are pushing away all the things that we feel that, okay, this is something that is bothering me. Let's not think about it. I will start distracting myself from it and I will come to a different place that, okay, you know what? No, I will think positive about it. And in the process of that, I would say a toxic positivity, we are not acknowledging what we are really feeling. So that is R, embracing your real emotions. The C part is challenging your inner critique. So our self-talk, our belief system, whatever that we are having. So that is something that let's challenge it through. That's C. L is listening to your body's wisdom because genuinely body keeps the score. Genuinely, our nervous system is the one which keeps the score as to what is happening in our body and how we reacting, responding to different types of situations there. And it gives you signals in the body. So am I really listening to that signal? Am I really listening to what is happening in my minute sensations in the body? So L is for listening through it. A is aligning yourself to the identity or your values. So a lot of times we are not aligned with it. For example, our time, we are giving it somewhere else. The energy is somewhere else. And the values are something else. So aligning all of these things to identify what my values genuinely are will help it through. So that is identifying it. A is aligning yourself with that authentic values that you already have, or you have recognized it after recognizing a different you. And M is manifesting your future self, manifesting your future self in the present moment and then going ahead. So with this, it's a big acronym, I would say. But at the same time, this is the process that we go through in a therapy, in a workshop, where I go ahead with teaching and understanding and becoming more aware of these aspects of it.
So what is the I? I just missed that out.
I is
Reclaim.
identifying your, what you say, the values that you have.
Okay, so align yourself to so A stands for the alignment and I is
Yes.
the identification.
Yes.
Okay, fine. That's a great yeah. So technically, let's say somebody who's suffering from a burnout, I can identify that. Where a lot of times you really don't feel like getting up at all, or you don't feel like getting up and going to your office. You just are too stressed out or too maybe mentally tired. So, how much time would it take for someone to achieve this clarity and reclaim oneself? So,
That's
would
a
it be
very good
different at
question.
different stresses stages at where you would be?
Yeah. So firstly, I would say it is genuinely first to understand and to become aware of it. This is the first step. That if you're not aware about it and we're just pushing it out as to, I will scroll for another 2 hours, I will scroll for another 10 minutes, but you don't understand where that 2 hours has gone. So that is when our body is so tired of the entire day and the processes, and the body is just shut down. That's how our nervous system is responding to the body aspect. So that's what is happening, that I just don't want to scroll. I just don't want to see things how it's going forward. And with this, coming to the question of how much time does it require, it depends on how much are you allowing yourself and committing to the fact that I need to come back to myself. There is no particular timeline for it. They can come back in 2 months, they can come back in 3 months, or they feel like, okay, 1 week is enough. But that's how our thinking process is, that I want to control my burnout situation. That's the belief system behind it, that I want to know how much is it, what is it. But in the process, one will understand how much time does it take genuinely to come back to yourself and feel it and process it as well.
So this is something which this is something like an internal burnout, right? You're burning from inside. So while you have an external physical burn, you can identify he has had some 50% burns or 60% burns. There's some quantification. So the treatment is very scientific, depending whether he can be actually cured or not. How does one measure this internal burnout?
Measure this internal burnout. That's a good
And,
question.
and yes, this is something where yes, okay, he needs to be like one. You have a certain degree of whatever in an allopathic way, you would find that out. Okay, you need to be just taken to the hospital or shifted straight to the ICU. So
Yeah.
how does one recognize that yes, this is a burnout, a fit case? Let's pick him up, transport him in an ambulance, or directly connect him into a Zoom call with Elisha. How does that and when does that happen?
Yeah. So firstly, to understand the signs of it, that's one. Exhaustion, being disconnected with yourself and the people around. Your understanding that I'm just not being aligned with what I was really interested in. Losing interest in your hobbies, losing interest in your work. Understanding that it's just right now too much for me to handle. And you're just not feeling like falling someone also. Just you start feeling you're shrinking yourself. Understanding that these are the signs, one will understand that, okay, this is something that I need to take one step ahead and talk to a professional. Now, when you go ahead and talk to a professional, they will go ahead with some kind of an assessment to understand what is happening inside you. Also, to understand that what is the intensity of it. Is it mild? Is it moderate? Or is it severe? Also, one of the very important things is with burnout, there are a lot of other things, other psychological conditions that might also come into the picture. So, probably an individual might be numbing themselves for a very long time, probably with alcohol or any other concern that they might be going through. So, there are internal layers also to it. And you go through with the assessment part, I would say, and then understand what's the intensity. Also, the comorbidity we see as a professional, is it also that the individual is having addiction? Is it that the individual is also having any kind of anxiety, past concern that they have, or their history? We also take case history of the person. So that's how we understand as a whole as to what is the context, where they when it has started, how frequently this happens, and this often comes with a stress response. Like our nervous system is something that keeps responding to the outer situation. So there are three types of responses. I'm sure many of them might know about it. It's a fight, flight, and freeze response. So usually a person goes into a freeze response when this condition is coming into picture, where their feelings unheard, and then they go ahead with understanding that what is the concern situation, and then we go ahead with psychoeducating them related to different aspects, and then we go ahead with the therapy.
So these three situations, the fight, the flight, or maybe the freeze,
Yeah.
uh, is that all connected with maybe once what one calls is how mentally tough one person is, and is it that some individuals can cope up with whatever is thrown at them so they can fight? Some individuals just can't do it, that they just escape, as you say, that's the fear, or and the third is they just get paralyzed, or they just can't do anything about it. So one is even fighting, as you say, with whatever courage you have, is it the right thing to do doing it alone? because one may be really foolhardy and going into something which he doesn't know how to tackle it, and he might try to fight it at first, and then maybe freeze, and
Yes.
then we'll just flee.
Hmm. That's a very good and comprehensive question, I would say. I would try to break it through and get it through as well.
Yeah.
So, so what is the first response to any kind of situation which was unexpected? Okay. So, for example, I remember once there was a monkey in my kitchen. Okay. I'll just share that incident. And that was really fun. And the response I was into that I just screamed. Okay. I screamed to the top of my voice that I think everyone might have heard. And my mother came in and she's like, call. Intercom hai ghar mein. Like there's an intercom. Call the watchman that that this is at home. So can you see the both responses right now? Mine was a freeze response. I screamed. Okay, that was my first response. And my mother's response was to actually fight for it or to see that okay, we need help. We need something to go ahead. That's where how our nervous system is already learned. It's a stress response. If I am into stress, what is the first step that I, and this was something that I was in earlier, and I understood that okay, I got into a freeze response. Now what? How long will I take as a person to come from this freeze space to actually do some action and to go ahead? That's how we build resilience. That's how we understand that okay, we need to get into it and then get it through. And with this, it's not cognitive. ऐसा नहीं है कि next time ऐसा कुछ situation आएगा ना मैं अलग तरीके से response करूँ. That's going to be a lot cognitive. If you understand that time, that's great because a different chemical is released around in your brain around that time whenever the stress response is happening. So that is how you go ahead with dealing with that kind of a concern and issue that time. So even if it is fight, flight, or freeze, nothing is wrong. There is no good and bad. That's just one understanding the stress response is this. And becoming more aware of it helps you to go ahead and work towards it. Is the freeze response helping me anywhere? Is the question that I have to ask. I just gave an example of a monkey, but the other situation. So, for example, scrolling on internet or scrolling on my mobile phone. Is it helping me? Okay, it might help me for some time. It might help me for just 1 hour, probably, or 2 hours, how much ever it is. Is it helping me to get that into my life and then put that energy in the day or feel the joy inside and go ahead with it? I might not even know how many things I have scrolled and put likes on. And if that person asks me, hey, you, thank you so much for acknowledging my post, and you'll be thinking, हाँ मैं तो अभी सोते सोते किया था, like and comment or something like that. So that's how presence is so much important. Being present with yourself, and that's what we are aiming for. I would say I am aiming for to build that presence within so that it's there.
So, at what stage does a client come to you? Does he come at a stage generally where everything is just over and he could have come maybe, so the question is, he could have come maybe uh, two stages earlier. Simple.
Mhm. Mhm.
So I believe most of them would be coming at maybe at when it's completely broken down,
Yeah.
or when you are getting the signals that something is not wrong. Then that's the time when somebody should come and take support, so that one doesn't go to the advanced stages. So are there any such stages where you could, like, you have a stage 1, stage 2, stage 3, stage 4 cancer, something in stage 5 is just you're gone, so something like where you could, or maybe you could think of having something where, okay, this is the stage where these are the patterns you identify, that's where you should come and maybe take where you could have got a 10 mg tablet and something of a 1 week of your course, and you could have been cured. If you're
Yeah.
coming in stage two, it's a 2 month therapy. So it's something like, how does one know? Is there a checklist? Is there a Excel template, or how
We
does
have a
one?
burnout checklist
Yes.
available. So that is something that one can go through. At the same time, I have created a quiz where you understand, are you genuinely just disconnected with yourself, or are you in the phase of burnout? So that helps you to understand it, which phase you are in. Is it disconnection or is it a burnout stage? And with the signs and symptoms, I feel it is, if you get through it and if you see that this is the signs and this is this initial stage that you're talking about, at which stage is it? This is the initial stage. This is the part one, part two. जहाँ पर थोड़ा सा feel हो रहा है and you feel okay, I think I should take help. This is a good time to take help rather than completely getting isolated or completely being disconnected with people. You might be having friends around you are, you don't know what their well-being is like. You just don't know their whereabouts. And they've just been so swamped in their work. And this work is very good escapism, of identity, I would say, where you keep saying that, hey, I'm really busy about it. And you know what, I have so much of work right now. And how much is that person is so much into that work that is not giving that kind of a thing in the outer space. So this is the initial stage. Understanding, going through the quiz would help them. It will help them in two ways. If they come to the course, they will have some kind of a thing as understanding that, okay, what can I do to cope with it? So coping mechanisms जो वो लोग use करते हैं to cope with it, this is something that will help them.
Yeah. So wouldn't it be quite convenient for such a burnout checklist to be made available with each HR department of every company, so that they can give it to their employees, and they could take a test, so that
I
they would
missed out
know
on
that
a
they really.
question. Could you repeat?
So wouldn't this checklist, this burnout checklist or the burnout quiz, be given to employees of every organization as a mandatory exercise
I would
annually?
love to. If that can be incorporated in the corporates, I am sure 4 out of 5 people would be going through this. So if the organization genuinely recognizes this and want the employee to have a good well-being, this would really help. Really, really help. And thank you for that suggestion and question as well. I would think about it.
I think it should be. I think it should be done. But Deepak, it's your turn.
Thank you, Abhijit, for all those relevant questions and very clear and simple answers. I'll just read out a few comments from the people on the chat. Tanya says, yes, how much I am supposed to rest and what is the type of rest needed? This is on point. So that makes sense. Then she also asks, how is burnout different from depression? So why don't you go ahead and answer that one first?
Love. Firstly, I would not tell you right now that how is it so different, because we have a lot of assessments to go ahead with. That's one of the things I would say. Burnout, as I said, that there are these signs and symptoms. And once you go to a professional, they will get a better space to go through that big assessment. We have like this 25 questions, okay, which now I can ask her and I can just go ahead and understand what it is really. But understanding that, I just need help, right? That is a good enough space to surrender to that space that I need help. And I'll just go ahead and see and ask professional. Then it's their job to then see that, okay, what is it really like? We have like these 2-3 sessions and then we come to any kind of a labeling to the client. We will not see अच्छा आपको ये symptoms है ना, मतलब depression ही होगा, because there are a lot of comorbidity we have to see, history देखते हैं हम, trauma देखते हैं हम individual का, बचपन से क्या क्या होते हैं, तो ये सारी चीज का combination is something, then we go ahead and say that okay, you know what, this is something that it is, but that label is not to label that individual, we are here to label the symptoms. And this, a lot of times, individuals take it very personally, I would say. That, oh, I have depression. Like, hey, that is just the tag or it's a label given to just understand that we are having symptoms so that we are better able to recognize कि ये आता है depression के. So not to personalize it, and at the same time be open to seeking help. That's what I would say. Not to wreck your brain as to burnout hai, depression hai, anxiety hai. Not your task. Don't even ask ChatGPT. They will keep validating you. They will keep
Yeah.
validating you. अच्छा तुमको ये हो रहा है, that is okay. You should be good. So yeah.
That is the highlight of today's session. Don't ask ChatGPT. It will just reinforce the faith. It will tell you yes, you are in depression
Yeah.
even if you are. So she has
One
another
of the
question.
interesting,
Yeah.
sorry,
Yeah.
I
Yeah.
just interviewed.
So
One of the
please go ahead. Yes.
interesting client, she came to me and she's like, you know what, I did ChatGPT, मुझे ना ये symptoms है, मुझे पता चल गया ये symptoms भी कहाँ से आ रहा है, so I will do this. So I just asked her, okay, then how do you want us to go ahead with it now that you know the answer? कि ChatGPT ने तो already बता दिया ना कि क्या concern है करके. So like, how do you want to go ahead? She's like, no, the thing is I understood from your, but I'm not understanding your. So that's the charm of, actually, I feel ChatGPT will not be able to replace a therapist, how much ever you do it online.
Validation is what people are looking for. And then Tanya has this one more question. She asks, is it possible that our responses change over time, especially with respect to fight, flight, or freeze? Will that response be different when I'm young, when I'm middle aged, when I'm old, or it will all depend on your mental state?
That's a good question. So, interesting. I will think on it. Okay. So this is where it comes. So, for example, the freeze response that I had was for just a little while, like ice cream. If I know, the earlier Elisha would have been in the freeze response for probably 10 minutes. I'm screaming, I'm not knowing what to do and how am I supposed to go ahead with it. With therapy, with understanding yourself and the triggering points, the freeze response would be a little lesser time. The capacity or the response time, I would say, has reduced. ठीक है, पहले I'm going on a shock space, in a shock space, and I'm like, hey, oh my God. And then like, hey, I know how to deal with it. Chill, relax. I will go ahead with that. So it's that kind of a thing where you're just like recognizing it because you know that, hey, you know what, I've worked through this. You know your body is safe. And the more safe you will be feeling in your body, the better you will be at responding to different types of situations.
So my question, over time, the response change in entirety now.
I can't hear you properly.
Oh, am I audible now?
Yes, it's
Is it possible that we entirely changed our response? Like earlier, our response could be always fighting the minute something comes up, but now slowly move towards freezing, like
your
taking
voice
time.
is cracking. I'm sorry
Okay.
to intervene. Okay.
I'll just put it in the chat. Continue.
Sure.
So Tanya is in the car, probably that's where we are missing out on the signal. Okay, so we have Rita Soni, and she wants to ask you a question directly. Go ahead, Rita. Yeah.
Yeah. Elisha ji, my daughter is computer engineer. She was working in Capgemini. She left suddenly one day after 3 years her job, that I'm very tired, this and that. And she left. And we didn't force her to continue or something like that. Whatever you want, you can. But I suggested that you should have one thing, something in your hand, then you should read. But she left. She said, I want to give this exam, that exam. She ordered all the books, but again, she said, I don't want to study. Now I won't be. And she left. Then suddenly, I am doing, what work I am doing, she said, I'm interested in this. I also want to work. I said, okay, fine. So one of the company known to me, I told her to join there. She joined there. But after joining this company, 1 month was okay. From second month onwards, because she was never been into sales, and this was sales pressure, or I don't know what it was. After coming home, her behavior was completely changed. And sometimes she was saying something which I know that company, I know that those people cannot behave in such manner. And in the same meanwhile, one of her friend in neighborhood, he said that this is a symptom of schizophrenia because my mom had this, and this is the beginning stage. You should consult a psychologist. We went there, and doctor said that this is delusion, something like delusion disorder, something like that. And he treated, and we stopped her going to that office. 10 days she was on medicine and she was fine. And she was talking normally, everything was fine. Whatever was happening in the office, she was coming home and shouting at us that we did this with her, and that is why she is getting such kind of behavior in office, this and that. That was she was saying. After 10 days, she got okay. After 10 days, she went to office for resigning or something like that. So all other formality. When she came back, she again in the same mood. She just met me and she started shouting at me. And then again we went to doctor. Doctor said that you should continue for 1 month, this and that. And then she left that job and continued. One of my friend psychologist, he said this is the problem of Gen Z. They don't want to take responsibility. Just give them a slap and they will be fine. He was telling me like that. But
Was
then
this a
that doctor was
psychologist
saying,
or your friend?
he was a friend, and but he was doing something in this only, in this scenario. I mean, psychologist or something, not doctor, but something in that category. So he said that. But then my her friend who was in neighborhood, and in suggestion, doctor continued the medicine for 1 month and 2 months, and she is almost all right. And now she's saying that whatever I have done, I have written in the book, because she used to write. And now when I'm seeing those things, I'm finding that what I did, I mean, it was no connection that I can do this, but I did. But in the meantime, I studied one article and I told her to do blood test. And blood test said that she has B12 deficiency and D3 deficiency, which can also lead to such kind of behavior. So what exactly it is? Is it I need to treat the B12 deficiency and D3 deficiency, or what psychologist said that she has depression, this, or this is the reason originated from these deficiencies?
Before Elisha answers, I just want to say this. Let us not try become doctors or therapists or psychologists on our own. Let's go to
Correct.
a professional and let them decide. Over to you, Elisha.
Thank you so much, Deepak, sir. That is much needed. Yeah. Yes, Deepak. So,
Yeah.
I would say it requires a holistic healing. It's not
Okay.
just something, and very, very important, please go to a professional. It's not something that a friend or person who's doing something in the mental health has the credibility to heal such kind of condition. So every psychologist is also not a therapist. Every therapist is also not well equipped with handling severe cases.
Mhm.
So every person has a different specialty and the expertise in. So I would want you to go to a psychiatrist. So there's a combination of things that one has to go with. Of course, the blood test is important. Yes, that also needs to be incorporated. Holistic healing is important. Psychiatrist intervention is important, and the therapist intervention as well. So
Okay, so
all
I
these
I
four,
should continue both.
yes.
medicines for B12 and D3, and psychotherapist
But
treatment.
also don't take this conversation as the only way to go ahead with any kind of direction, because I genuinely don't know the entire story. So I want you to go ahead with whatever that you spoke from there, to go to a psychiatrist and a therapist and take the lead from there, rather than taking this as one of the way to have that kind of a direction. Is it making sense?
Yes, yes. Yeah.
Yeah.
Thank you so much, Elisha. Thank you.
Thank you,
Thank
Rita ji. Thank you, Elisha, for one really actually sharing your real life story, and Elisha also saying that don't take this as that one shot treatment, or don't take this as advice. In the end, a qualified professional needs to do one diagnosis and then treatment. Also, from what I know and from personal experiences, having met so many people across the country and the world too, you know, psychologists or psychiatrist type treatments are not 11-day or 1 month or 2 month treatments. These are long term medications, 3, 3, 6, 6 months, almost sometimes a year too. Only then, and then, these things have to be tapered down. You don't simply stop taking a medicine like this. It needs to get tapered
Very,
down
very
slowly,
true.
that your body gets adjusted to all these things. So let's take the conversation ahead. One or two questions. Are some parts of society or some type of people more susceptible to these sort of problems, mental wealth or mental health issues? And when I say, I'll just take Rita's example. She said she was a high achiever. She was in ABCD company.
Mhm.
Are people who are employed, or you people who have, these high pressure targets, more inclined to suffer from these people, or it can happen to anyone?
Yeah, including you. And I feel just as one goes to a doctor for a physical concern, if they have cold, cough, anything, I feel mental health also needs to be monetized in that manner, where I'm sure everyone might have gone through different situations and difficulties in their life, where just not self-reflection would have helped them from going through the darkness of things that they are going through helps a lot for all of these things. Definitely, I would say the people who are susceptible to lower income, different environment that they are born and brought up, all of that things really has that add-on in the well-being of the individual. So that is, of course, one of the people, but at the same time, it can happen to just anyone, anywhere, without any reason, which is impossible. We can't even say that iske wajah se hi hua. Sometimes the reason is just not it.
I just want to check, Elisha, there is some sound which is being picked up. Is it from your side? Is there somebody else close to you who's speaking or talking, or, a little bit of background noise is
Okay. Is it still there?
Yeah. Yeah.
Currently, I
As
feel
if
I don't
somebody is
have a
talking.
control over it.
No. Just checking if there's somebody else in the room, either on the phone or speaking to someone or something like that. Okay, because everybody else is muted, and hello, let's proceed. Doesn't matter. We heard that real life example of Rita, and she told us that at some point somebody or a doctor or a trained professional gave her, some medications. One thing to understand is, again, we clearly understood that medications should not be given, by non-qualified people, or we should, not try and diagnose these things ourselves. How do you come to know that the person I am going to is a professional, a degree, a doctor? Because in this day and age, especially after COVID, we've seen a lot of mental wellness and coaches and trainers, and suddenly announcing to the world, I've arrived, I'm this, I'm that, I can help you this. So when you know someone who's facing problems like these, whom do I go to or whom do I not go to?
Lovely question. Thank you. That would help a lot of people to understand that whom they can reach out to.
Yeah,
Firstly, understanding that whether a person is a psychiatrist or a psychologist. That is an important understanding first. Second, if they are a psychologist, what is their credibility as to what are the certifications and degrees that they have taken? That is one of the most important things we ask, and it's just okay to ask these. It is genuinely okay. Don't feel as if I shouldn't be asking because they are already a doctor, a therapist. How should I ask? No, that's your right. Understand this. It's your right to understand to whom you're going and seeking. That's your first thing. Second, understanding that they should be either a clinical psychologist or a counseling psychologist to go ahead with therapy part. And there are a lot of other people also, and I'm not saying no to people who are already doing excellent amount of work, even without certifications. Okay, they're doing great, and I really respect it. When it comes to clinical case, I genuinely want other people also to refer and to understand that, okay, this is not in my capacity. I should also refer or collaborate and coordinate with such professionals to go ahead and do it together. You know, probably a doctor is required, probably a therapist is required. And if you're doing something, that's great. Do it. We will not touch that part of you. Okay, that's your expertise, that's your domain, that's great. Also to understand that collaborate with such people so that it helps for a higher well-being of the patient and client who is coming to you, and that trust is not there. And I've seen many people who jinka trust break. If they see that, what, I've been to a psychologist, but they have not treated me well. Understand what type of a psychologist you've been to. Also, is that a counselor that you've been to or a psychologist? And
yeah.
if psychologist, what were the degrees that they are taking? So these all are important things. I would also add one more thing with this, is how much the therapist has done the inner work is also important to understand.
Yeah,
Yeah, because only a degree of a therapy will not take you through. Because I remember when I completed my master's, and I'm like, it didn't even started. It's like you just know cognitively everything. But what is there in your world?
yeah,
What is there in my world that I still need to feel, understand, take care of it, hold that
yeah,
space for myself, and to break my own beliefs, to break my own conditioning of my childhood and relate to so many different things.
yes,
So that is also an adding thing as to how much they have also done the inner work. So a person can ask them also that, have you taken a therapy? Okay. To understand whether that's also a credibility to go ahead and see
yeah,
what is it. Okay. And third, it's also understanding whether they are doing some kind of a continuous learning. So that's third, whether they are into any kind of a learning. And fourth, and very important thing is what approach they are using on the therapy. So there can be many different tools, techniques, and what type of approach they are using for a client. That is fourth and very important. And fifth, I would say, what is your vibe with the therapist? Because it's a two-way thing. It's not a
yes,
one-way thing.
yes,
It's not that therapist is above you and the client is below.
yeah,
We both are equal. And are you feeling equal in the therapy is also important to feel it. And
yes,
if you feel the therapist only has the command, then you just have to go ahead with it. It's equal. I totally feel. So, five things.
yeah, yeah. So again, my next question to you is this. You know, 2 or 3 decades ago, I remember when we were really, I mean, young or children, at that time, mental illness meant ye aadmi pagal hai. It was taboo. Even when you discussed or talked about it, you were not even supposed to talk about it. In today's day and age, This is something a lot of people are going through. There is therapy available. There are qualified doctors and people available who help you become okay and people recover. What has changed in these last 2 or 3 decades? Is it the family system that has got broken up? Previously, we had joint families. There was support from, extended family. Now everybody is staying in their own pigeonhole where there are 3 or 4 people, out of which everybody is either working or at school. Nobody gets a chance to meet anyone, speak with, talk with others. What has changed?
So I feel it's not that the earlier generation has not felt this. The earlier generation has felt it more. They have felt it more. The thing is, there might not have that kind of an awareness that this is actually going on inside my mind. And with all the society things, what we all have done, and the previous generation, what they got married, they have procreated, and a lot of their concerns, issues, and everything else is also being passed on to our generations. Okay. So with that passing on to the generation, with this age, day, and everything, now people are becoming more aware of it. It's just the awareness has become so much, and thanks to COVID as well. I think the COVID space has actually brought everyone to the space. This is happening not just with me, but everyone. That was a time, the most challenging time of our lives, where we were supposed to, understand ourselves more in the quietness and in the stillness of it. So that is where I feel it might have passed on to it, and we all are feeling from it.
Again, problems like these, diseases like these, mental issues like this, they don't happen overnight. It's not that you went to sleep last night and today you woke up and you are suffering from a mental illness. No, this thing happens over time. Are there, typical signs that, others can use or make out or then be able to reach out to people? You know what? I'm seeing these signs in you. You probably need help. Are there signs like this that come up?
Interesting. So signs, there are many signs. So, firstly, understanding, I would say a lot of us are still understanding themselves. So in that space of one understanding themselves, we are yet to understand what do I really want. Because there is so much of conditioning which has already happened since our childhoods, with parents, with our society, with everyone around us, that they have told us that we should be doing something. Okay. Now, I don't know what subconscious has already taken, right? That have I actually taken the message of someone else that I should be this, or is it something that I really want? So that is a kind of a thing that they've already conditioned. They're already conditioned into that this is how it is. And hey, I'm sorry, I just lost the track of the question.
Okay, so the question was typical signs, telltale signs which family members or friends or people who are close to you who can pick up those signs and probably go and tell you it's time you went and met a mental health specialist or a psychiatrist, maybe even a psychologist or even a doctor.
Yes. So if they start becoming too aloof, that's one. Something that they really used to like earlier and they're not liking it now. Second. Third, anything that used to bring joy to them, but right now they're not feeling joy towards it. That's third. Fourth, feeling that, probably they're shrinking more and not talking to people. That can be something that people can recognize as to, okay, this is something that पहले तो ऐसा नहीं था, अभी ऐसा क्यों? That's it. Because instead of labeling to aisa kyun kar raha, genuinely being curious as to, hey, is there anything up with, or can you share and talk about it? So having that space with people and trusting people would really help other people also to do it collaboratively and in a community space rather than isolating and labeling them as tum aise ho. So these things at the same, and more to it, I would say they are feeling low. Weight loss हो रहा है या weight gain बहुत हो रहा है, appetite lose कर रहे हैं या बहुत ज्यादा खाना, भूख लगी ज्यादा ज्यादा भूख लग रही है या बहुत कम भूख लग रही है, अचानक से weight increase हुआ है या बहुत ज्यादा decrease भी है. Probably they might be getting nightmares at night. The
Yeah.
sleep is broken. Any kind of a traumatic event that has happened in the past is still having a lot of impact and intensity at this point of time.
Yes.
That's quite a reflection. You just have those images because that image is not going. You're just trying to put it out away, but it is still there present. So the trauma that one has gone through, that is something that the person is reliving that trauma again and again with that flashes.
Yeah.
And I remember one of my mentors, he told, that's his words when he said that you're reliving the trauma. That trauma might have happened once too, but the amount of times that you're repeating in your head is something that you're reliving that trauma again and again.
Yeah.
And probably you might have got abused once, but you're getting abused multiple times in your head. And that's where I really genuinely want that, hey, it's time to sit down. It's okay to do it. Surrender to the fact that I might have people who can help me in this space. That's how true.
One last question before we officially close and probably we get inputs from our audience. What pushed you or what made you enter this field? A lot of us, when we are growing up, people want to become doctors, engineers, and astronauts and pilots. Who wants to become a mental health professional? What makes a person decide that this is something I want to do?
Yeah. So I will be very honest here. Okay. So when I was in my 10th standard in my 10th standard, I realized one thing. I've been super curious about people. Okay, how people think, how people are talking. How is one friend so different than other one? And I used to be a person who used to have different types of friends. Okay? And I just felt like, how is it possible that I'm able to take care and have a different dynamics with so many people at that age? And having so bizarre friendships, like how is people so different than each other? And that was very much fascinating. And I was like, I don't really need to know more. I just need to understand what is it really like. So that's the time I am really grateful to my parents, for that matter, that they told me to, we went to a career council. And one of the things that career counselor told me was, explore. I think this word was enough for me, explore, not to come to any conclusion, not to have that label that you should be doing this or that. She just saw that personality and everything was very good in terms of arts. So she said that go ahead and explore in this area. And when I just came across as a psychologist as one of the tag, when I was searching through it, this is so much in tune with what I'm looking for. And and having more people around, parents around, dealing with them, I think everyone has done that. You have a lot of curiosity as to how to deal with these people. And that is also encouraged, subconsciously as to how can I deal with my father? How can I deal with my mother? And also in this space, when I understood, of course, I have a high inclination to help people. So that is also adding thing to going ahead.
When you have a qualified doctor, a practicing doctor in the audience, we would love to take her views also, even though she's joined in the last 5 minutes. I'm sure she can add a few tidbits of hers. Yes, Dr. Alka.
So what are you discussing?
We are discussing mental health, psychology, a psychiatrist, and why people go through these episodes.
Yeah, so our mental health is declining today because we are sacrificing our little joys in our life. Little joys. कहीं से कहीं आवाज आ रही है क्या?
हाँ, वो background में कुछ आवाज है. Close करिए. No problem. Last question.
Okay, so there is a kind of we are sacrificing our little joys in our life, and we are only focusing on work, and the cortisol levels are rising, and all the epinephrine and the sympathetic system is on high power, and we are causing inflammation in our body, and all the happy hormones are not being secreted. The oxytocin is not coming, dopamine is not coming, calm, and loneliness is setting in. And the reason for loneliness is that we are not talking to people, we're not sharing our pain with people. So all of us should have one person at least. I'm saying at least 2 3 people in our lives with whom you can go and share. आज ऐसा हुआ, आज ये हुआ, आज उसने ऐसा किया, आज उसने ऐसा किया. So earlier we had joint families, we were sharing with everybody in our family, and we were telling, and we were getting some kind of advice also. But today that system is not there, and even friendships are behind the phone only. So even, even because of the lack of human connection, and because of the lack of oxytocin, which is our antidote to cortisol, our mental health is declining. Playfulness is not there. Playfulness, खेलना आना चाहिए. हर चीज में थोड़ा थोड़ा खेल होना चाहिए, हंसी मजाक होना चाहिए. Because we are concentrating and we're becoming very serious with ourselves, with our work and with everything, with our relationships, we are becoming very serious. मेरे पास टाइम नहीं है. अरे टाइम क्या, टाइम आपको एक फ्लाइंग किस दे दो ऐसे. आप कुछ आंख मार दो, आप कुछ जाते जाते अपनी मामा को टच करके जाओ, मामा आपने खाना खाया कि नहीं खाया. आपकी वाइफ को बोल दो कि मैं आपको शाम को आके मिलता हूँ. I'm definitely going to be able to give you some more time. Just say a few words which you can say to your near and dear ones. Because of that lack of connection, we are having lack of those happy hormones, and that's why our mental health is declining. So
You
please start and stop complaining.
Amit is missing. I think he had logged in before और वो जरूर याद दिलाता था कि गाना तो बनता ही है. And before I say final bye bye, and before I thank Elisha, एक suddenly गाना याद आ गया. मतलब वक्त ने किया क्या हंसी सितम, तुम रहे न तुम, हम रहे न हम. Last word to you, Elisha, before we close.
Thank you, Dr. Alika. That was something, of course, that's like just one aspect which I would say, just put like one touch over it by saying this. So
Thank you.
Wonderful, wonderful. So it's an hour on a Sunday afternoon we spent talking with Elisha about mental health, about wellness, about psychiatry, about psychologists, how to find the right, practitioner, the right person who can treat you, whose wavelength is same as you, who is not here and you are not here. So we've learned from her experience. I'm sure there are many takeaways. We had a real life example with Rita sharing her daughter's story. Wonderful to have been, hosting this program, the 269th episode of the Sunday Bloom Talk Show. Looking forward to you all joining us next Sunday on the 270th Sunday Bloom Talk Show, which is going to be just 2 days before Diwali.
Yeah, before we leave, I have something to say.
Please, please.
One thing which I have genuinely felt it and learned it through.
Yeah.
That your product is not equal. Feel like you are working. You feel that that's how I'm going to take the self-worth thing. That is something that's been one of the biggest highlights in terms of burning out.
Yeah.
So yes, with this, and lots of love and lots of joy to everyone.
Yes.
Thank you
Let's
so
bring
much
in
for
joy
hosting this.
during this festival season. Let that joy come into everybody's life. See you again on next Saturday on the 200 next Sunday. Why did I say Saturday? Next Sunday on the 270th Sunday Bloom Talk Show. Bye everyone. God bless us all.
Thank you.